All right, so I'm going to go ahead and get us started. My name is Maria Bloyer. I'm Director of Programs and Outreach at Advocates for Justice and Education. JE is the federally designated Parent Training and Information Center for the District of Columbia. We are also what's called a Health Information Center for families. And that's some of what we do under what's called our F2F grant, family to family work. And we try to give families the information that they need to navigate not only the education system, but also the healthcare system from a place of knowledge and empowerment. So tonight it's part 2 in a 3-part series. We're going to talk a little bit about some of the laws that impact education in DC with a particular focus on students with sickle cell. The 3 big laws I'm going to tackle are the homeschooling law in DC, the home and hospital instruction law. We're going to talk a little bit about health plans, and I'm also going to do a really quick recap of last week's conversation. Does that sound like a plan?
Yes.
Hope so. Okay. All right. So, like I said, that's what we're going to do. Really try very hard to tell people what I'm going to do and not surprise you. So a quick review. For those of you who don't remember, last week we went over just on a high level with special attention paid to the impact for folks with sickle cell, 504 plans and IEPs. So this is kind of the quick and dirty nutshell condensed version. A 504 plan provides a student with a disability that impacts a major life activity with access, accommodations, and modifications at school or in any other place where federal funds are provided. And in DC, that includes, just so you're aware, some services. This is a unique thing about the District of Columbia. Children who have 504 plans in DC can access services like transportation and speech language. IEPs are provided to students who have one of 13 listed disabilities who need special education because of that disability. You might remember from last week, we talked about this as the nexus requirement. You had one of the 13 disabilities, and by reason of that disability, you needed specialized instruction. Students who are eligible for a IEP have a right to what's called FAPE in the LRE, and that's the right to a free, appropriate public education in the least restrictive environment appropriate. The IEP is bigger than the 504 plan. So it has everything that a 504 plan has, plus additional procedural safeguards and the right to specialized instruction. Okay. And if you might recall, there's a robust process and infrastructure around the special education process. And it starts with evaluations, referral consent, moves to an eligibility meeting, IEP review, and a reevaluation to determine eligibility every 3 years. Generally, if you recall, IEP meetings are held at least annually, but possibly more if needed. Okay, again, this is just a quick reminder. And then my 3 kind of favorite points from last week, all of which were ones Ms. Gibson reminded me to talk about. First, our parents must sign consent for evaluations and initiation of services. You know, parents really are the center of this whole process. And that's why their consent is so important. And that's why it's required. Parents also have the right to documents in advance of meetings. Specifically in DC, they have the right 5 days in advance of the meeting. And they also have the right not to sign documents at the table. In other words, it is perfectly okay to take it home and think about it. And parents have the right to bring others to meetings with them. And you can do that both to support yourself, but also to bring folks who may have additional information to share about this, to share with the team about the student. So just don't forget that, you know, you don't have to go to these meetings alone. And if you think there's someone else who would have valuable insight, it's perfectly fine to invite them to a meeting at the school. Okay, so that was the recap part. Okay, so that's where we were. And now we're going to go on to some new laws. Does that sound okay? Maybe? All right. So I'm going to start with of the 3 kind of areas of law we're going to talk about tonight, this is my favorite. This law was introduced in 2019. It was just passed in 2020. And much to my irritation, it will not be fully implemented until 2022. but it has already started to have some real changes. Um, so, and let me kind of walk you through why and how it's so important, because I think that'll help you understand how to use it as a parent. Um, Home and hospital instruction was determined in DC on a school by school, on an LEA by LEA basis, on a local educational by local educational agency basis. So that meant that DCPS had a different set of rules than Friendship Public Charter School, had a different set of rules from KIP, from, Imagine Public Charter School. They all, that means we had like 70 different home and hospital systems going on in DC, which wasn't tenable, really. Parents often had no awareness of their rights. And then, even more frustratingly, schools often had no awareness of the fact that they had an obligation to provide home and hospital instruction. And this was particularly true in the charter sector. I know I worked with several parents who called me up and said, my charter school just told me if I want home-based or home and hospital instruction, I have to withdraw my kid and enroll them in DCPS. And that kind of thing happened a lot. So there was a real need to kind of regularize and create some standards in the district for who was able to receive home and hospital instruction. And just so you're aware, home and hospital instruction is exactly what it sounds like. If you have a student who cannot attend a school, they may need instruction at home or in the hospital, depending on where they are. And this is not separate from, but in addition to their rights that they may have under a 504 plan or an IEP. Okay, so it is entirely possible for a student who does not have an IEP to receive home and hospital instruction. Okay, and it's entirely possible for a student who has an IEP to receive home and hospital instruction. So I don't want you to think that they're like connected somehow, or that they're linked or dependent. They're not dependent on each other, and they exist in relationship, but it's not like you need to have one to have the other. Okay, schools are thankfully starting to move towards what they're going to be required to do in school year 2022. So we'll talk a little bit about what they're going to have to do in 2022, so you kind of know why this stuff is getting built out now. First of all, every school is going to have to designate a point of contact for home and hospital instruction. This alone is going to be a big difference. And we've started to see this, and this has started to make a change already. Parents can request home and hospital instruction in writing or verbally, and the school has to acknowledge that within 2 days. Okay. LEAs, so that's local educational agencies like KIP or whatever, or DCPS or Friendship, whatever DC school system your child's in, they have to issue a decision about home and hospital instruction within 5 days of the completed application. Now, this is a big deal. This is a big shift, because I know some schools were taking 30 days. Well, my God, after 30 days, the kid might be back at home, back at school, right? So the whole time they were eligible and needed home and hospital instruction, the LEA was deciding whether or not they would provide home and hospital instruction. So this is a big shift. And schools are already starting to comply with this, even though they don't have to. The biggest shift is that the student, there's rules about that OSSI, the state educational agency, is going to have to promulgate the regulations around this. They haven't done this yet, but everyone knows it's coming. And so instead of schools being able to make up their own rules as they see fit, they're going to have to comply with a consistent state definition, which is important because it'll bring DC into alignment with Virginia and with Maryland and pretty much the rest of the country that has a statewide rule for how to do this, instead of asking every single little tiny LEA in the District of Columbia to make a decision about home and hospital instruction. And I think most importantly, services must start within 5 days of that decision about whether or not you're going to grant home and hospital instruction. Now, I want to step back a little bit from the law for half a second. and remind folks that if you are working with a student who may have frequent hospitalizations or, frequent short-term hospitalizations and then maybe some time at home, there is no requirement that you that you request home and hospital on a reactive basis. You can do it proactively. You can say, I am just because of their medical history, because of what there's going to probably be 5 days out of every school year where we're in the hospital. And, out of every one of those 5 days might have like a 10-day period where they're home for whatever reason, or whatever about the student you're working with and their treatment. So there's nothing wrong with setting it up on a proactive basis. There's nothing wrong with getting the approval and kind of making those arrangements in advance so that there's minimal disruption. And that's really kind of the biggest advocacy tip I can give parents is whatever you do around home and hospital, your goal should really be to minimize disruption. Disruption in minimize the students' disruption in their educational process. Okay. So the other thing I want to flag about home and hospital is, again, OSSI is going to be in charge of the process. I would ask all of you who are working in this space to kind of keep this on your radar. We don't want it to fall off of OSSI's list of things to do. And we're also going to probably need to give them some feedback on those comments when they are published, because I know that sometimes they're not thinking sometimes of all the kids out there. Sometimes, they're only thinking of the most common home and hospital cases, which are usually like a significant injury, or often childbirth. So, just keep that in mind, that we want to keep an eye out for that. Parents do have a right to appeal the LEA decision, and OSSI will mediate. So now that we're in this kind of limbo, right? Because this is how it was, kind of a little bit of a mess, to be candid. And in 2022, it'll be really organized and wonderful. But in the interim, what can we expect? Well, LEAs are moving towards compliance, which is good. And right now it's still LEA by LEA, but the most egregious errors are being really limited. I'm not seeing any schools say anymore that I don't have to do home and hospital, or I don't have to listen to what your doctor says. I have a right to just decide unilaterally. We're not really seeing that anymore, just honestly, because this legislation's passed and schools are more aware of it now. Now, I do want to be transparent and say that because of the COVID response, limited in-person instruction is happening anywhere. Some hospitals are still not allowing a lot of visiting, and the law does specifically make allowances for telehealth during a public health emergency, that kind of thing. All right, so that's home and hospital instruction in a nutshell. Just to give you a sense of timeline, this bill was originally introduced in 2019. People have been lobbying for it for about 2 or 3 years before it got introduced, passed in 2020, and not going into effect until 2022. But just it's the fact that it passed has already started to make a difference. So I'm really hopeful. It's a very much needed piece of legislation. But before I shift to health plans, does anyone have a question about home and hospital? Concern, question, thoughts about how it might apply to some of our sickle cell kids? I think the fact, by the way, that it's going to have that quicker timeline is going to make a big difference for kids, especially those who are in and out a fair amount.
Good evening. Hello.
Yes, ma'am. Hello.
Good evening. Because here I'm from Africa and the Gambia in West Africa. I believe maybe most of you there you might not know or you have read about the Gambia.
Wonderful. So welcome. Thank you for joining us. Unfortunately, did you have a question about home and hospital instruction?
Okay, yes, I do. I had a son and he's a sickle cell patient.
Mm-hmm.
Okay. Most of the time we are in and out of the hospital. sometimes like late hours at night, he might have these crises, and sometimes I don't know what to do. And here in Africa or in the Gambia, it's very difficult for one to call the hospital care at night, or even take your kid at that time of the night to the hospital. Sometimes it's risky. Only in the morning, or whereby you are mobile, that's the time you can drive and you can take your kid to the hospital. What I wanted to know, what are the precaution measures that one can take if at all your child might have those crises at night and you are at home with him?
So I am unfortunately probably the least qualified person to answer
Oh,
that, because
oh,
I'm a lawyer.
oh,
So,
I'm a
um,
paralegal.
I'm an American lawyer, and I'm licensed in DC, Maryland, and Virginia.
Wow, that's
So
really nice.
I'm good for the Beltway, on legal questions, but I don't quite know a good answer,
Okay, you
for you.
based on legal question, because if it is time of legal question, it's like it's a different avenue and a different area. Maybe there in America or in Maryland, your legal measures might be different from ours here in Africa and in the Gambia as a whole.
I am certain they are, but what I can do is your email, because you registered, your email is in the system, and I can connect you to any resources our co-sponsors have in mind that they might be able to share with you. Does that make sense?
Thank,
But that will
yeah,
happen afterwards. Is that fair?
thank you very much. Yeah, I'll be very grateful if I have that, and that
No,
will help a lot. Yeah.
no problem.
Oh,
Okay. So I'm going to
thank
transition. No problem. Thank you for joining us.
you.
Um, so I'm going to transition from home and hospital plans to health plans. These are things that many of our students have, and they have a couple different names. Again, this is one of those artifacts of DC having so many different local educational agencies. We sometimes are called nursing plans or wellness plans or action plans. For children with sickle cell, I've seen them called crisis action plans or crisis response plans, or I think I've seen one called something like, sickle cell crisis nursing response plan, things like that. But they're all, despite all these different names, um, they're health plans. And they are very analogous to the 504 plans that we talked about last week, but they're specific to the student's medical needs. These plans should be created in consultation with the child's treatment team, the school-based medical staff, other school staff, the student, and the parent. Um, and I want to be really clear about this. The best plans, the best health plans, are those that, one, actually, work, right, and can be implemented, which means it really shouldn't just be a conversation between, your doctor or your patient advocate, or your patient liaison on the medical side and the school nurse. Okay. It needs to be a little bit more than that. And that's because you need to make sure it's actually going to work, right? So you need to be aware of kind of the whole environment that this kid's operating in at school. When they go on field trips, how they get to school, how they get home from school, when they're moving around the school. So I always really encourage parents to, definitely start a conversation with their treating team, their treating professionals, loop in the school-based staff, but the school-based medical folk, but really also try to get as many people bought into that plan as possible, especially if any part of that plan calls for the student to have to self-advocate and say, I need to go see the nurse, or I need to do this. Because the more people who are on board and aware of it, the more effective it will be. Now I've already made a mistake, and I said school nurse. I want to spend a minute on this. It's really important that parents get clarity on who the medical staff at the school is. um, and know when they are there and what their licensure level is. And this is important for a couple of reasons. One, it's important because, especially in DC, not everyone is licensed to do everything. And not everyone is licensed to exercise clinical judgment, right? So a nurse can exercise clinical judgment, whereas other medical staff who may be supervising, the student's medical experience at school, or supervising the health room or the nurse's suite or the wellness suite, whatever your school calls it, if they're not a registered nurse, they don't have the ability to exercise clinical judgment, which means that your health plan should not be reliant on that staff member being able to exercise clinical judgment. So I try to really work with parents when we're creating health plans to make sure that they have a good understanding of who is actually at the school and their treatment team is aware of who is actually at the school. What is that person's licensure? What's their capacity? When are they there? Not every school has a nurse in it all day, every day. And that's a big deal. I know for me as a parent, it's changed, how I did things. My oldest had really significant severe asthma, and, we had to adjust his asthma action plan when we moved from Virginia to Maryland. Because in Virginia, there was a registered nurse on staff who could exercise clinical judgment, and the doctor and her could work together. And in Maryland, we don't have that. You don't have an RN on staff. So it was and that meant the orders that the doctor needed to write were different because they couldn't be dependent on the person in the health room being able to exercise clinical judgment. So and I know it sounds kind of like a obscure point, but I think it's really important to make sure when you're working on these wellness plans, to make sure that everyone knows the school's capacity and licensure. Which brings me to my last point. Ask for what your student needs in a health plan. Okay, if that's medication that needs to be kept refrigerated, ask for that. If that is, supervision for certain activities, ask for that. If that's someone who's capable of collaborating with the medical team, whatever it is, ask for that. In part because schools can use this to get what they need to meet your needs. So just be really clear, ask for what your student actually needs in this space, and don't be afraid to push a little bit. The school says, oh, we don't have that here. Okay, but this is what we need. The school can figure it out, especially if it's something, straightforward. So, be clear, ask for what your student needs and figure out what that might be in consultation with, your treatment team. But this is a space where your decision should be based not on what the school's capacity is, but on what your student needs. And if you ever feel in these health plans a shift in who's doing the work, for example, if the school says, well, we can accommodate your student who has a need to take medication every day at noon, if you come up here every day at noon and deliver it. That's an unreasonable request of a parent. Okay, it's not reasonable to ask a parent to come up to the school every day at noon to deliver the student's medication or to provide to medicate the student. Okay. So ask for what your student needs. Your student needs to be able to be at school and to have medication at noon. Now, if you feel more comfortable delivering the medication yourself, if you want to show up and do that, that's fine. That's a decision that you need to make as a parent within your family. But please don't do that because the school says that they can't. Because they can. Almost always they can. Does that make sense? Does anyone have a question? So health plans can exist with or whether or not the student has a 504 plan. Oftentimes, if a student has a health plan, I think we need to have a serious conversation about whether or not they need a 504 plan as well. And they can have a health plan and an IEP. And traditionally you want to, if the student has a 504 plan or an IEP, you want that health plan also to be attached and be part of that document, just so that there's an awareness there as well. Does that make sense? Do we have questions, thoughts before we jump on?
Yeah, I do. Now, suppose a child, the school does not have a nurse that can administer the medication. Does the parent have a right to ask the school system to put them into a school where there is an RN?
Oh, that's a good question. So I would say yes, absolutely. Yes. If the school cannot administer the medication, yeah, I would say absolutely. And I would say that that's a 504 claim and a health plan. Absolutely. Now there might be some pushback to that. But I think that is a completely reasonable request. I think it's supported by law. It's completely reasonable. And the school's response, in my experience, is to staff up that classroom, staff up that school with somebody who can, in fact, deliver the medication. Does that make sense?
I had a question. This is Nene. I wanted to know, does this extend to college students, or is it called something different for college students?
Oh, that's a good question. So for college students, it usually comes under, well, one of two places. It's usually something that's captured in the disability services program. So depending on what the school offers for medical care, it's usually at this point would be an accommodation under ADA for a college student. So it's a little bit of a different framework there, but so yes and no is kind of your answer. It's usually under ADA, it would be captured under ADA or Section 504 of the Rehabilitation Act for students who are in college. You know, depending on what level of care the school provides generally to students in terms of, you know, medical care, there would be, you know, a conversation about, you know, what does this look like for them. One thing I would really recommend, and I can make sure Ms. Gibson gets a copy of this, is we have a great webinar that we did with Got Transition, which is the Alliance for Adolescent Health. Oh, I'm going to butcher their name out. They're the Alliance. They're something amazing. They're the Alliance for Adolescent Health Care and Transitions, I think. But they do really good work, and they have a great 3-part webinar series about the transition to adult systems of care. And it's nice because they have one part of it that's angled at professionals, one part that's angled at parents. So it's really just speaking to parents about supporting your students' transition to adult systems of medical care. And then they also have one that is for young people themselves on preparing for a transition to an adult system of care.
Okay.
I will make sure that I give that to Ms. Gibson and she sends it around, but it's 3 really good webinars, and they've got some great tools for students who are getting ready to start college about kind of how they might need to manage their healthcare needs differently, especially once they are, you know, an adult and have that legal obligation there, even though they might not have all of the skills that we might want them to have. Does that make sense?
Yes, that makes sense, which kind of leads to the next question, if you don't mind, real quick, is for young adult sickle cell patients who are professionals in the work environment, and we've had to explain to their employers, you know, their medical condition. So I was wondering, is there something like a framework that you have on the legal side that we can use to sort of give us a framework of what to tell the employer? Because there's certain information that clients don't feel comfortable explaining to their employers, but yet we still have to explain to them their medical condition, but do it in a way that it doesn't come across as, I can't do my job as a result of me, having this medical condition. Is there something that you could offer?
We have a lot of resources around this, and I'll pull them together and send them to Ms. Gibson as well. So I would say two things. One is that, really, it's supposed to be a collaborative conversation, an interactive conversation between the adult who needs the accommodation at work and the employer. And the role of the medical system is supposed to be determined by the person seeking the accommodation. So they're really the ones who kind of set the tone and the framework for that. I always recommend that people frame this in terms that people frame this conversation in, this is what I need to be successful, right? These are the things that I need for me to do the thing that you want me to do, or that we both want me to do. And be solution focused and have, specific asks. But I also think it's important to remember that it is an interactive conversation. So it's not, one of the hardest shifts, I think, for people coming from the K through 12 space to the adult space is the fact that in the K through 12 space, there's this obligation on the school to identify, locate, and evaluate students with disabilities. They have an outreach obligation. And in the adult ADA universe, the burden is really shifted. The burden is on the person with the disability. And it's difficult for a couple of reasons. One is because they may not self-identify as a person with a disability, but that's what the law requires for them to get accommodations and modifications at work. And that's a big deal. And for some people, it's kind of a little bit of a culture shock when they have that moment. And then there's this reasonableness notion in the law. The law doesn't say that all accommodations that a person with a disability needs to perform essential functions of the job, it doesn't say all of them have to be provided. It says reasonable ones have to be provided. And there's an interactive conversation, an interactive process to determine what's reasonable. And that's radically different than what happens in the K through 12 space. So we have some really good links around that. Most of them are focused on young people themselves. If you follow AJE on Twitter or Instagram or our Facebook page, every Tuesday we push out what are called Transition Tuesday tweets with specific content related to this issue. One of them is around self-disclosure. One of them more recently was about, what accommodations do I need actually? Like, I don't know, figuring out what might be helpful to you. But I guess the short answer to your question would be, I really recommend a solution-focused conversation. So yeah, a solution-focused, outcome-oriented conversation where the young person can be in a position to say, this is what I would like, this is what I need. And here are things that are actionable and doable. Instead of just saying, I need a flexible schedule. Well, kind of articulate what that means for you. So if I need to say to my employer, my boss's name is Rashonda, and if I need to say to her, Rashonda, I need a flexible schedule. That's awfully vague, right?
Right.
Maybe what I need to say to her is, Rashonda, I need a flexible schedule because, and tell her why. Maybe I'm making an FMLA claim, or maybe I'm undergoing treatment for something. Or maybe I have a relapsing remitting MS and I'm like, look, I need a flexible schedule because I just don't know what I'm going to feel like in the morning some days. But I promise I'll communicate, and this is the expectations, and so. But I would recommend really getting a sense of what you need, and then having a solution-focused conversation.
Okay, thank you.
And I will, I'll send Miss Gibson some of those Transition Tuesday resources. They really are good, and I'm a big fan of them. Okay. Do you want to talk more about health plans, or we feel like I can go on to attendance plans, attendance laws? Feeling good?
Yeah.
Okay. Attendance in DC is a big thing. Okay. It's a big deal. I don't know how else to say it. DC has a complex set of attendance rules with lots of variation between LEAs. However, there are some really clear citywide rules that have consequences. So I want to spend a minute on this. All right. So first of all, school attendance is compulsory in DC. Okay. For students who turn 5 as of September 30th to the age of 18. Okay. So if you are 5 years old as of September 30th of that year, you need to be enrolled in school. Okay. And you have to be enrolled in school in DC until you are 18, not 16, 18. Okay. Now, DC has kind of a 2 referral bucket system for kids who are not attending, who are truant. So if you have a student who is under the age of 13, who has 10 unexcused full school day absences, okay, that family will be referred to CFSA. Okay, that is, and CFSA is the District of Columbia's Child, Family, and Services Administration. It's the Child Protective Services in DC, okay? That family will be referred. Now, one of the difficult things here, especially, is that some schools don't differentiate between very tardy and a full day absence. So this means if your child is very tardy, 10 days, okay, that could trigger a CFSA referral. Okay. Now for students who are aged 14 to 17, they get an extra 5 days. So it's 15 unexcused full school day absences. It's 15 if you're over the age of 14. But the referral, instead of going to Child and Family Services, is now going to Court Social Services and the Office of the Attorney General for prosecution. Okay, so this is a big deal. Now schools are mandated, they don't have any discretion, they are mandated to make these referrals. Now they are not supposed to make the referrals without taking some steps to address student attendance first, like making phone calls, coming up with an attendance plan. However, they very often don't do what they're supposed to do there. And they don't take those additional steps first. They don't have a meeting with the family. And while they're supposed to do all those things, they still are, after that 10 and 15 days, they really don't have a lot of discretion. They really have to make that referral. As a result of that, I really encourage parents to stay on top of attendance as much as they can and get as much documentation and get it submitted as quickly as they can. I also really, really recommend that parents do that to the best of their ability via email. And if you're not a person who has access to a scanner, which like most people in real life don't have access to a scanner, take a picture with your phone and email it to the school. If there's a note from your doctor's office, or you can get your doctor's office to send it directly. But this is a significant thing, okay? And just to kind of bring that home, under DC law, if you're a parent, guardian, or legal custodian of a minor who's absent from school without a valid excuse, that's a misdemeanor. And under CFSA, it can bring up a charge of educational neglect in DC, and there are a good number of educational neglect cases. So I really encourage families to stay on top of it. especially because the collateral consequences of even that referral to CFSA, even if, you know, if you miss the 10 days and it gets referred, and it goes away right after it's referred, you are still then a person who has been referred to CFSA, which can have collateral consequences for employment. Okay, especially if you work with children. Okay, so I really want to hammer this home with people. This is a big deal, you know. So I just want to reiterate, children aged 3 to 13, 10 unexcused absences triggers the referral to CFSA. For older students, it's 15. Okay. Initially, the local school district determines what's a valid excuse. So your local school determines what's valid initially, although all of that can be looked at if there is a neglect matter that comes up. So my tips are document absences early and often, keep those records, err on the side of over communicating. You know, over communicate with the school. We're out today. We're probably maybe going to be out tomorrow. I'm not sure. This is what we're doing. You can contact me here. Really err on the side of over communicating. And then I know this sounds kind of common sense. Avoid absences whenever possible. You know, and this was a change that I had in my own thinking, to be honest, as a parent and as a professional. You know, there's a really good body of research that shows us that, you know, missing, and it sounds a little common sense, but, you know, missing school has a real impact. So if you can avoid it, you know, avoid absences whenever possible. Look, it's real life. It happens. You know, my own kid left, you know, missed 2 classes today because we had to go to the doctor and there wasn't another appointment available. So I'm fully cognizant of the real life part of what I'm saying when I say avoid absences whenever possible. But I do think it's important. The research around educational outcomes, you know, is pretty impressive. You know, every day in school really does matter. And I was surprised by that. I used to think, I was like, oh, you know, it can be made up. And it can be, but, you know, the research has made me really kind of think twice now before I schedule an appointment in the middle of the day. But that's the most important part that I want parents to know about DC's attendance laws. So DC is a mandatory school attendance, age 5 to 18, not 16, 18, 10 unexcused for little guys, 15 unexcused for big guys will trigger court involvement. Okay. Questions? I know this is like a depressing one. Okay. All right. Last little bit of law. So
I'm sorry, I have a quick question.
Yeah, go for it.
Do you know what the attendance law is for Maryland?
Not off the top of my head. No, not off the top of my head.
Okay.
Although I think I can pull it up, and if I can pull it up easily, I'll add it to my bundle of emails to Ms. Gibson. All right. Last little bit of DC law, homeschooling. So really quickly, homeschooling is different from school at home. It is different from home and hospital instruction. Homeschooling is different from school at home and home and hospital instruction. It's a totally different thing. Homeschooling in DC is where you have broken up with or gotten a divorce from, whatever metaphor you like, public education. Okay? Homeschooling in DC is where you have broken up with public education. And you are no longer asking a public school of any type or a private school of any type to educate your child. The parent is responsible for the child's education. Okay? So homeschooling in DC is perfectly legal. And we also know that disproportionately, students with disabilities and students who've had a tough time in school are signing up for homeschooling. So I always like to mention it in conversations like this because I know that students who have disabilities or have unique medical needs often find homeschooling attractive. So a couple of things you need to know. Homeschooling in DC, while perfectly legal, does require that you register with OSSI. Okay. Parents must meet certain basic qualifications or have those qualifications waived. Basically, in order to homeschool, you have to have a high school diploma. Okay. Or you have to have that qualification waived, either through, you demonstrate that you have a GED or some other model of competence. Okay. Parents must provide regular and thorough instruction, and parents must meet minimal curricular requirements. So you've got to cover, history, science, art, math, physical education. And the parent must keep a portfolio for review in the event that there is an audit, but there's not a guarantee that your portfolio will be reviewed. Homeschoolers in the District of Columbia do have the ability to access some programs. DC doesn't have a particularly robust Tim Tebow law, but we do have some access to athletic programs for students who are homeschooled. But there's two big things that they do not have access to, and that is a DC high school diploma, nor do they have access to equitable services under IDEA. So if you're a student with an IDE, if you're a parent of a student who is IDEA eligible and you elect to homeschool, you will receive no equitable services under IDEA. You will be on your own, okay? But I do always like to let people know that this is an option and that some parents have had great experiences with it. But I also want to make it clear it's very different from home and hospital instruction, and it's very different than what we are doing right now with COVID and the learning at home. Okay. Do people have questions about that?
Yeah, I have a quick question about homeschooling.
Yep.
So you emphasize the parents' level of education. If a parent feels strongly about homeschooling, is it possible for them to hire someone to take on that role in their place?
So yes and no. So the parent can supplement what they do with other resources. And that would be fine. It's a little bit fuzzy about when homeschooling and participating in like a homeschooling co-op or purchasing a curriculum or buying a tutor, like when does that become a private school versus homeschooled? And the real bottom line in DC is the parent is the one who's basically responsible. I do want to point out that again, the minimum basic requirement is a high school diploma. And if you can display, competence to teach the content that your child needs, OSSI will waive that requirement. And it can be waived through a GED or other display of competence. So it's a reasonably accessible system. And I know that OSSI is really dedicated to working with families on this who are interested in it. But I think, unlike, for example, say in Maryland, where you have to have a sponsored approved curriculum, that's not something you have to do in DC. Does that make sense?
Yeah, that makes sense.
Okay.
Thank you.
Yeah. And for what it's worth, I am unaware of anyone I'm unaware of anyone who has been determined to be unqualified to homeschool. I'm sure it's happened, but I'm not aware of it. Okay. Well, that was everything for tonight. You've survived. Let me tell you a little bit about what's coming up. So next week, we're really kind of doing two parts, right? We're doing advocacy skills, kind of that high level, multi-topic advocacy skills that you can use in a lot of different settings. And then we're also going to talk a little bit about parent and caregiver rights in the workplace. Raising a sickle, we've talked a lot about the rights of the child at school and in the educational context. But I also want to talk a little bit about the rights of caregivers, and that's things like, FMLA and some of the laws in DC about not discriminating against people who have caregiving obligations. Okay. Questions? maybe. Okay. I see.
I don't have any questions, but that was quite a bit to take in. So I may have some questions later. Would that be okay if, some of them need to contact you directly?
Absolutely. And I will pull everything together in into an email, a bundle of all the things I said that I would send you, and get that out probably not tonight, but maybe Monday.
Yeah, that'll be
That's
fine.
fair?
Yes.
Okay. All right. We'll have.
And also, I just wanted to let them know that it's recorded. So can you let them know when the recordings may be available? Would it be after the whole series?
Yep, I'll do a big, basically what I'll do is at the end of all 3 series, I will do a unified single blog post that has the links to all 3 and all the materials I handed out, just so that when you guys want to share it, you just have one link to share. You don't have to cut and paste from 10 different places. Okay. Does that sound like a plan?
Sounds good.
Thank
All
you.
right. Thank you. Have a good
Thanks,
Friday.
Maria. Have a good
You too.
weekend. And
You too.
thank you for joining, everyone.
Bye-bye.
Thank you.
Thank you very much. Thank you, everyone. Thank you very much. It was really interesting to know the law that govern is it in America or Maryland in America? It's
Yeah.
quite different from ours in the Gambia, but I really enjoyed the section.
Okay, and I just sent you an email too so that we can connect next week.
Perfect.
No problem. Thank you so much, Patricia.
Okay,
Bye,
thank
Lisa.
you.
Okay. Thank you, everybody.
All
Thank you.
right, bye-bye.